Business Unity South Africa is throwing its weight behind the Presidential Health Summit and government efforts to provide healthcare to the whole population. It says health security and universal health coverage are key to economic growth, job creation, productivity and much needed investment. And business has proven to be a reliable and responsive partner to government during the COVID-19 pandemic. Let's discuss business's stance further with board member of Busa, Stavros Nicolaou. Mr. Nicolaou, good afternoon. Welcome to today. Thank you very much for your time. Do you, as business, share the President's views about the way forward regarding the implementation of the National Health Insurance, NHI?
Firstly, thanks very much for having me. And if I can just preface my response by mentioning that we were very pleased as part of Busa to participate in the Presidential Health Summit. It demonstrates the priority that the presidency is placing on healthcare. Of course, we know the impact that healthcare can have. Recent memories around COVID, and both economic cost and lives and livelihoods that were destroyed. So it's really good to see the president taking the lead on healthcare. In regard to national health insurance, business is supportive of NHI and universal coverage with some provisos, of course. These provisos are that we are still able to have a sustainable private sector that collaborates together with the public sector to deliver what the outcomes of NHI and universal coverage are, and that is to attempt to equalize healthcare between the two sectors, and then, of course, to deliver optimal healthcare to all the citizens that, of course, deserve and constitutionally have the right to healthcare in our country. We have a very particular model that we discussed at the summit to segue into universal coverage. And some of those interventions model-wise include taking on low-income medical scheme members. So these are members of society that are either formally or informally employed but cannot afford or are presently not on a medical scheme. So you could take off the hands of the state several hundreds of thousands, we believe, of members of society through these low-income schemes.
Yeah, now COVID-19, as you yourselves have said, as Busa, Mr. Nicolaou, really exposed or shown a very strong spotlight on the inequalities in our healthcare system. But according to the President as well, from what I heard, it also affected the implementation of the Presidential Health Compact, in which business is a partner. How badly did COVID-19 affect the progress, for example, to make sure there's universal coverage in healthcare?
There's no doubt our country, like all countries around the world, were affected during COVID. Most of the resources and emphasis were placed on managing a pandemic that, quite frankly, we hadn't experienced a pandemic of this magnitude for over a century. So it's natural that many of the existing programs would have lagged behind. These are programs like we've addressed routine vaccines in the country, or vaccinations, non-communicable diseases. So we're starting to see a surge in non-communicable diseases like cardiovascular disease. Diabetes in particular is starting to rear an ugly head in our country, and a rising tide of diabetes. And then, of course, we are the country in the world that has the highest HIV infection rate. And naturally, there was less responsiveness by patients during periods of lockdown and during periods of COVID. So we are lagging as well with respect to the HIV program. Not as many people are taking antiretrovirals as they ought to be taking. And it's now a case of clawing back those lost programs, or programs that somewhat stalled. So not an unnatural reaction or effect in our country, but one that we've seen in other countries as well. The only difference is that we have one of the most disproportionate disease burdens of any country in the world, and that is why we need to claw back with both swiftness and decisiveness.
Yeah, and I guess that burden with disease, as you've just explained, is something that needs to be tackling. It is something that needs to be prioritized. But I understand you as business, I mean, you do have some frustrations with the entire regulatory environment. Tell us about them.
Healthcare is a highly regulated sector, one of the most, if not the most regulated sector. And in order to realize an effective, appropriate, and suitable private-public collaboration, like the one that we saw during COVID. The collaboration between private and public sector during COVID was immensely effective. But we can't say, well, it worked in a once-off in an emergency case. We need to take forward all the good aspects of that. But taking forward the good aspects require government to act with swiftness around reducing red tape, administrative burden, and also to improve the ease of doing business in the healthcare sector. So without those elements, we're not going to get the effectiveness that the private sector can bring into the overall equation. So today, or yesterday at least, when I presented to the health ministers and members of parliament, etc., and the entire healthcare fraternity was there, this was a particular point that was emphasized quite heavily. So we require both swiftness in regulatory reform. We also require those regulations that are in place to be swiftly implemented, because many of these things are already in existence but are not being implemented timelessly or not being implemented properly. One thing that immediately springs to mind that enjoyed high attention at the summit over the 2 days is the local procurement of pharmaceuticals and medical devices. There's policy incoherence there, and unfortunately policy is not being properly implemented. And the casualty here is the country and the fiscus. So these are some of the type of reforms that need to be applied more swiftly, and we need to reduce both the cost and improve the ease of doing business in healthcare so we can attract further private healthcare capital into the healthcare system.
Yeah, what's a possible role, Mr. Nicolaou, of business in assisting the public sector to strengthen its efforts towards what you say you'd like to see, which is the localization of medical products, including medicines, as you've just said, and other related consumables and equipment?
One of the strong spotlights that we spoke about that was shone on the COVID pandemic was that our country didn't have sufficient capability and or capacity to produce things like PPE, some important pharmaceuticals, and certainly we saw the rearing of the ugly head of vaccine inequality. So there's been a concerted effort to both establish capability and capacity of vaccines and other pharmaceutical products, such as antiretrovirals, oral contraceptives, and other type of products. But that's going to require implementation, a proper implementation of the Preferential Procurement Framework Act. So these enablers in legislation actually exist, but it's a case of the three ministries, in this instance, Science, Technology, Innovation, Health, and Trade, Industry, and Competition, aligning on policy, but more importantly, the procurement ministry and or department, which is the health department in this instance, procuring according to what is in the Preferential Procurement Framework Act. Of course, in doing all of this, we should never have to pay a premium beyond what is fiscally neutral to the country. So many countries around the world have localized and industrialized their pharmaceutical and medical sectors by paying some type of a premium that enables a multiplier effect back into the economy. But that premium should not push beyond what is fiscally neutral in the country. So by way of example, you might think it's a wise decision by saving $1 on a pack of antiretrovirals, but you might be losing $3 in economic impact. So that's actually a bad procurement decision because you've lost $2 back into the economy. So the fiscal ceiling there would be $3 in the example I just gave, and that is what we need to start implementing in our own country, as many others have done around local procurement as an effective lever to industrialize.
Thank you very much for your time this afternoon on Today on eNCA. That's Stavros Nicolaou from Business Unity South Africa.